Hi, am I audible?
Yes, ma'am. Yes, ma'am. You're audible.
Yeah. So, good evening, everyone. Hope you're having a good course, great course, and a lot of learning happens. So, can we have the screen sharing, please?
Smitha, my voice is not clear.
Uh, how about it now? Yeah. Okay. So I will keep my video off so that network is better for me.
Ma'am, you're not audible anymore. Can you please be a bit more coherent? Your voice is very low.
Just a minute. What about it now? Hello?
Yes, ma'am. It's better now.
Yes, ma'am.
Yes.
Okay. Yeah. So who's going to share the screen?
Yes, ma'am, I'm sharing the screen.
Great. Next slide. Okay. Can you do this? Yeah, the screen sharing as such, I mean the presentation mode. Okay, yeah, fine. So if you look at the health system in the country, our health system is one of the best health systems in the world. Go to the previous slide. No. Yeah, yes. Previous slide. Okay. So India's health system is one of the best health systems in the country. And, if you look at it, we have both public and private health. So the healthcare system is being provided by the public, that is the government, as well as the private players. And under the government, we have the Ministry of Health. And it is not only the Ministry of Health, but all other departments like the Ministry of Defense, Ministry of Railways, other small other departments are also providing healthcare in whatever small way possible. And apart from that, when we look at the Ministry of Health, it is divided between the state and the central services. So the state government is again giving services in the rural areas and the urban areas. The central government is also providing services in the rural and the urban areas. And apart from that, the central government is also providing services like employment state insurance scheme, or we know this ESI dispensaries and hospitals, and the central government's health scheme like the Ayushman Bharat and other schemes. And we have the central government medical colleges. We have the National Health Mission and the National Health Institutes and tertiary hospitals at the districts. And we also have the alternative care support like the Ayurveda, Yoga, Naturopathy, Unani, and Siddha and Homeopathy. So this alternative healthcare is also being dealt by the central government. And whatever is dealt by the central government will also be carried out by the state government as well. And specifically, the state government is looking at community health centers, and under that primary health centers, and then sub centers, and then we have the ASHA workers, who are the volunteers who meet us day to day and inquire about our health and keep communicating with us. And apart from that, in urban areas, the state is providing the super specialty hospitals, and Then there are institutes such as special disease hospitals, and then comes the district hospitals and the government medical colleges under that, and then we have the taluk hospitals. So the entire system covers different diverse areas or the locations of the country. And this is the specialty of our health system, that we are every citizen is being covered, or at least the planning is that every citizen in the country should be covered under the health system and should have access to the health system of the country. Next slide, please. And our health system doesn't stop with these services as such, whereas the health system also has different organizations which is looking at specific specialities. Like for research, we have the organization called the All India Medical Research Council, and we have the disease control organizations specifically for various controlling different diseases. And apart from that, we have the Central Bureau of Health Intelligence, we have the National Health Authority, and even for food safety and standards, we have an authority under the health department. And all these come under the director or Directorate of General Health Services. Whereas, we also have the Department of Health Research, as I told you before. And there are, again, Medical Council of India, Dental Council of India, Pharmacy Council of India, and Indian Nursing Council. So various councils are also working under the health system. Next slide, please. Having said that, every so when a great planning has gone behind the formation of the health system and running the health system, and ultimately, what is health? So I have given the WHO definition, but apart from this, can you think of something like a definition or what it means to you as a complete health? If 5 of you can respond, I would like to have a few volunteers. Maybe I can take 5 responses from you. Anybody would like to answer? What does it mean to you when we say about health? Anybody would like to respond? Hello, am I audible?
Ma'am,
Yes,
Yeah.
ma'am.
Yes.
hello.
Yes, go ahead.
Health means
Huh.
psychological and physical well-being.
Okay, great. Anybody else has any other different aspect? Anybody wants to try? Yeah.
Health is a state where health is a state which allows person to carry out his you can say works without any barrier, whether physical, mental, or any social.
Cool, cool. Yeah. Anybody else? One more person? Any different answer you would like to try? Feeling good about the body and mind. Yes, yes, super. So how you feel for yourself, right? It is not just a definition from outside, but how we feel within ourselves. Like, I'm so good, I'm feeling great. And when would you say that? When you don't have any issue with your body or the mind or the society, So health is not just the absence of disease or just the well-being of the physical body, but it is also the state of complete physical, mental, and social well-being. The social well-being is very important and the essence of everything. Yes, absolutely. Pooja Sharma is saying it's optimal well-being. Correct. So WHO has given this particular definition because having the key important message in mind that the social well-being is very, very important. Like only when your physical and mental well-being is intact, and when your socialization, because man is a social animal, and when your social activities, when you are part of the society, when you can participate on an equal basis with others, that is when you have the holistic well-being. So health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Next slide, please. So with regard to disability, there are a lot of the World Health Assembly resolutions on disability, and there is a lot of treaties or we have the UNCRPD, United Nations Convention on the Rights of Persons with Disabilities. So a lot of international instruments are there available with regard to health and disability. Why disability is being focused by WHA and by WHO at the international level? Because people with disabilities are always marginalized and they are not seen. They are always invisible because people with disabilities lack accessibility, and they have to encounter a lot of barriers because of the inaccessible infrastructure, and so they never come out. Then one big group of population are just staying inside, and what about their rights? So that is why go to the previous slide, please. Previous slide. Yeah. No. Back. Back. Yes, stay there. Next, stay there. So we have certain international obligations like the World Health Assembly resolutions on disability 2005, and in 2013 also we had one. And Global Disability Action Plan 2014 is there. And then we have the Sustainable Development Goal 2030 agenda, where goal 3 is good health and well-being. It is a general goal. It applies for everyone, all people with and without disabilities. And it is also talking about universal health coverage in 3.8, which is about providing healthcare facilities to everyone without burdening them with out-of-pocket expenses. So that is very important, and India has signed on the UHC 2030 agenda. Where is inclusion in this aspect? It is in Sustainable Development Goals. There are certain goals which applies directly for people, for all populations. So we have to take into account all the marginalized groups also, wherever that happens. So when Sustainable Development Goal is talking about end poverty or ending hunger or education or health, and sustainable cities, and all these general well-being, then people with disabilities or any other marginalized groups should be included. So that is why goal 3 goal 3, good health and well-being, and Go 3.8 UHC is very important for people with disabilities as well. And then we have the WHO resolution on assistive technology, which came in 2018, which talks about the importance of assistive technology in the well-being of persons with disabilities. And WHO resolution on community health workers came in 2019. And then we have the political declaration of UHC 2030, which is talking about moving together to build a healthier world. And this came in 2019. And recently, we have the WHO resolution on the highest attainable standards of health for persons with disabilities, which came in 2021, where it talks about the optimal health of persons with disabilities, and multiple aspects that needs to be covered for the health and well-being of persons with disabilities. Next slide, please. Next slide. Yeah, please stay there. So we have the United Nations Convention on the Rights of Persons with Disabilities, which is the kind of a Bible for all the aspects of persons with disabilities. And it is talking about health. So it has an article on health, and it is saying that there is the right to highest attainable standard of health for persons with disabilities, and there should not be any discrimination on the basis of disability. When we say that no discrimination on the basis of disability, it also means that it not only means direct discrimination, but also indirect discrimination. What do we mean by direct discrimination? When people with disabilities are not allowed into a hospital, or not allowed to give to take some information, or not being provided some information directly, health information, that is a direct discrimination. Whereas if there is no restriction for people with disabilities, and you are welcome to our hospital. People with disabilities are welcome, and the system is open to anybody, including persons with disabilities. Whereas when there are barriers, like when there are steps outside the primary healthcare center, or when there are stairs to go up to a meeting hall, or to a diagnostic hall, or the diagnostic table itself is not accessible, or the diagnostic equipment like an X-ray is not accessible, then again it is discrimination. So that is what UNCRPD is talking: no discrimination on the basis of disability. And it is further talking about the state parties should ensure that access to healthcare services should be gender sensitive, and it should include health related rehabilitation. And whatever quality range and standard healthcare system is available for the general public, the same standard, same quality and range should be available and affordable for people with disabilities also. And this also should include sexual and reproductive health and rights. And what else the UNCRPD is talking about? It is saying that disability health interventions, which includes early identification, maintenance, and prevention, should be made available, and health services should be as much as close to our community, close to the doorstep, and if possible, wherever possible, the services should be available at our doorsteps itself. For example, a person with a spinal cord injury may not be able to go to a rehabilitation center because of the barriers prevailing in the environment, as well as a lack of assistive devices like wheelchairs or whatever. So in that case, the system should come to him. The service providers, the rehabilitation professionals should come to his home and do the services that he requires, is what UNCRPD says. And there is also a need for sensitization of healthcare professionals, and informed consent of people with disabilities is a must. And there should be no discrimination in the health insurance. Right now we have a lot of discrimination, we have a lot of restriction and resistance in including people with disabilities in the health insurance system, which should not be there, is what UNCRPD mandates. And it is also talking about preventing discriminatory denial of healthcare services, not including food and fluids, which means nutrition should also be available for people with disabilities at their doorstep, and it should be of equal quality and standard. Next slide, please. Next slide. Yeah. So based on the UNCRPD, what we have in our country, because India is a signatory to the United Nations Convention on the Rights of Persons with Disabilities, and we have the Rights of Persons with Disabilities Act 2016, which is the national disability law in India. And this law is also talking about different provisions on healthcare for persons with disabilities. What are the What are the points that are mentioned in our act? It is free healthcare in the rural areas or within our own locality, and barrier-free access should be there in all government as well as private hospitals and institutions and centers wherever the healthcare is provided. So when we when we talk about healthcare, it is not only the main healthcare, but it is also the diagnostic and rehabilitative and any other paramedical support also comes into the healthcare system. And there should be priority for people with disabilities in attendance and treatment in hospital settings, and surveys, investigations, and research on the occurrence of disabilities should be carried out. Then promote methods for prevention of disabilities is also mentioned in the Rights of Persons with Disabilities Act. And at the primary healthcare center level, train the staff, train the all the healthcare professionals on the requirements of persons with disabilities, on understanding the needs of persons with disabilities, as well as understanding the disability itself, demystify the disability. So all these points are specifically mentioned in the Disability Act. And further to that, what else are mentioned? We have the yearly screening of children with disabilities to identify high risks and to disseminate information on general health, hygiene, and sanitation. So while we are talking about disseminating information, information should be made accessible to people with disabilities at the community level. People cannot go to the health center, go to the healthcare system. So the healthcare system should reach people at their doorstep. And if people cannot go and take information, the information should reach people at their own community. And information, general health information or any information for that matter, is not accessible for persons with disabilities. So health information should be made in accessible formats. For example, we have the sign language interpretation here for your class. And similarly, for people with hearing impairment or deaf people, health information should be provided in sign language formats. And similarly, for people with visual impairment or people with learning disabilities, intellectual disabilities, the information should be made available in an easy to understand format. And what else is mentioned? So we have the prenatal, perinatal, and postnatal care of mothers with disabilities and children with disabilities. And there should be promotion of awareness raising of disability and disability health through the schools, public health centers, Anganwadi workers, and media. And healthcare should also be available for persons with disabilities during disaster time and any humanitarian risks and emergencies, because that is the time where nobody is thinking about healthcare, but only in saving people. Whereas when you are saving a person with disability, what are the different health requirements that are needed at that particular point of time, that should also be kept in mind by the disaster management authority. And in that way, the safety, the safeguarding or the rescuing and then taking to the shelter and managing in the shelters. So all these things should be done. Many times during during disasters and emergency rescue, they just rescue the person alone and leave out the wheelchairs or leave out the assistive devices. then how will the person be able to manage if he or she is taken to a shelter without his or her assistive device? So all these aspects should be kept in mind by the Disaster Management Authority. And apart from that, essential medical facilities for life-saving treatments and procedures should also be ensured for persons with disabilities. Next slide, please. And apart from the Rights of Persons with Disabilities Act, we have the Mental Health Care Act 2017. So here the act talks about the rights of persons who have mental illness, and it also gives a definition on what is mental illness. So mental illness is a condition which affects how a person feels, thinks, and responds to stimulus, responds to prompts, and this condition impacts day-to-day activities also. Only then a person with disability, a person is considered as having mental illness. And so what is more important is mental health. Mental health is not only important for general public, but it is more so important for people with disabilities, and anybody who is having a mental health issue and on a long-term basis is considered as a person with disability, a person with a psychosocial disability. So mental health therefore refers to one's emotional and psychological well-being. And to ensure this, we have the Rights of Persons with Disabilities Act, and in Mental Health Act, there is a specific provision of providing legal aid to those who are identified with mental illness. And it is also talking about the administrative procedures of managing a person with mental illness, like admitting into a care center and managing them, and when to discharge. So these kind of how to follow up with them, these kind of rights as well as the procedural formats are dealt in the Mental Health Care Act. And it is also supporting the advanced directives. What are advanced directives? So advanced directives is not only necessary for people with mental health issues, but it is also very important for everyone, all persons with disabilities, and the people in general as well. When you have a health crisis, or when you get into a health crisis in the future, how do you want yourself to be treated? Who do you want to take the decisions for your healthcare? So all these come into the advanced directives. And the mental health care is the first act that is talking about advanced directives in India. And with regard to health, then the act is also talking about, it is having the power to discuss to deal with the government on establishment, license, and administration of mental health centers. So, kind of a regulating power with regard to the administration of these procedures are given in the Mental Health Act. And there are a few demerits also. So what are they? It is it is recognizing people with mental health issues, or people with mental illness as patients, or looking at the medical model, or treating medical mental illness or mental health issue as a clinical issue, and ignoring the multi-dimensional approach. What is the multi-dimensional approach? From in the beginning itself, we saw the definition. Health is not just the absence of disease, but it is a holistic well-being. So for health of a person, or for the holistic health of a person with mental illness, there are different aspects that need to be addressed, and not just treating the illness or the syndrome of the condition. So that multi-dimensional approach is missing in Mental Health Care Act. And it is also though it is talking about advance directives, it is not really talking about the nomination. How can I nominate somebody to towards my advance directives? Or there is no transparency of review boards. So these kinds of demerits are there in the Mental Health Care Act. Next slide, please. And another very important aspect of disability is rehabilitation. Though rehabilitation is generally required as a general requirement for people whoever get into injuries or any chronic health condition or whatever, people with disabilities need rehabilitation on a day-to-day basis. So we need physiotherapy, or many people need psychotherapy, many people need occupational therapy, vision therapy, speech therapy. So there are different kinds of rehabilitation requirements for people with different disabilities, which need to be acknowledged and it need to be addressed by the health system. So right now what is happening, the rehabilitation need is acknowledged only by the disability department and not the health department. Whereas health department is doing a small part for people in general, but it is not really looking into the specific rehabilitational needs of persons with disabilities. And in India, we have the Rehabilitation Council of India, and it is also managed by the RCI Act, and which is a law in India. And what do we see in Rehabilitation Council of India Act, RCI Act, is it is talking about the management of professionals, the rehabilitation professionals who would be providing the service. Whereas what is lacking in this act is about the rights of the rehabilitation rights of persons with disabilities. It is not talking about rehabilitation as a right of a person with disability, but it is talking about the procedures to be followed by, or the courses to be attended by the rehabilitation professionals. It is managing a registry, maintaining a registry of rehabilitation professionals, which is well and good, but it is only doing that. It is only talking about training the professionals. And the attitude of this act is to look at the professionals, the rehabilitation professionals, as human resource, instead of looking at persons with disabilities as a human resource, and to provide the required services which is their right. So this rights-based view or aspect is missing in the act. And we have the community-based rehabilitation, which is being carried out by the NGOs more than the government, the health department. While the health department provides rehabilitation services at the district hospitals or at the taluk hospitals, rarely gives at the taluk hospitals, whereas the health NGOs or the disability NGOs go to the community and reach persons with disabilities at the community, at their doorstep, and provide many therapies like physiotherapy, occupational therapy, vision therapy, etc. And WHO is also talking about rehabilitation as a set of interventions designed to make a person function to his optimal level, and the set of interventions which will help to reduce the disability in individuals with such conditions. So this kind of this kind of a view, this kind of an approach is actually missing with the health department while rehabilitation is considered. And WHO is also talking about the CBR matrix, which is a holistic matrix, where the rehabilitation is looked not only with the health approach, but it also looks at the education, employment, and social and empowerment angles, where it is holistic. It is a comprehensive model where a person is enabled to function optimally and participate on an equal basis with others on his own in his own environment and community. So this is how the health should be looked at. Whereas that approach, the holistic approach, the comprehensive approach, and the human rights approach is actually missing with the health system of our country, though it is really a good system and is capturing the door to door, the last person in the community. But certain specific disability focused interventions and human rights approach to disability is actually missing in our system. Next slide, please. So next comes the universal health coverage. As I told you, universal health coverage is one of the goals, the targets of the SDG, Sustainable Development Goal, and Goal 3 is on health and well-being, where we have universal health coverage as one of the components. And what do we really mean by universal health coverage? There is a general idea that universal health coverage means just health insurance. Health insurance alone is not universal health coverage. So wherever a person requires a health system, a healthcare service, that service should be made available to him, made affordable to him, and to enable him without making him to make out of pocket expenses. So as a person, I should not spend more on my health services, whereas the health service, quality health service, should be available in my community wherever I am living, and that should be adequate enough for me. So whatever health services I require, it should be available in my community, and it should be of quality, good quality, and it should enhance my optimal functioning. So universal health coverage has 3 dimensions. What are they? What services are covered? So health services, whatever health services are covered, and how much people have to pay to receive those services. So the financial protection, if I am not able to pay for my health service and the health service is not available free of cost for me, then the financial support should be provided to me. That is how UHC looks at it. And then which population should be covered? All populations should be covered, and not just one particular prototypical category, or a majority group should be covered and minority can be left out. No, all the minority people should also be covered, and whatever be the specific requirements of any population, whether minority or majority, should also be covered under universal health coverage. Next slide. So we have different health programs in India. We have the National Health Mission, and under the National Health Mission, we have the rural centers, urban centers, and now recently we have the wellness centers, the Ayushman wellness centers, where people with disabilities are being provided, are said to be provided healthcare in their own community. And we have the maternal and adolescent healthcare and child health program. We have the family planning. We have health policy and health insurance. Like I said, the Ayushman Bharat, or we have the other health insurance for employees, government employees. And then we have the disease control program. Now the disease control program is of 2 types. There are these communicable diseases and the non-communicable diseases. And under the non-communicable diseases, there are about 7,000 to 8,000 rare diseases. So out of which nearly 700 rare diseases definitely get into disability, like they definitely result into disability. So specifically looking at these kind of disability related diseases, and rare diseases is very important, which is actually not given so much of emphasis, whereas communicable diseases are given importance. Yes, it is very important because it should not get communicated to other people, and so the intervention and the prevention is necessary, whereas the same emphasis need to be given for people with non-communicable disease also, and all the rare diseases, so that people with disabilities or people having the rare diseases don't get into degenerated conditions or get into disability. And we have a few health conditions which got into the Disability Act recently, that is during 2016, which are the neurological conditions, chronic neurological conditions like multiple sclerosis or Parkinson's disease, and the blood disorders like the hemophilia, thalassemia, and sickle cell diseases. And we also have the acid attack victims, where though the acid attack is an incident and people recover from that, there are a lot of after effects which affects your body, your breathing, the functioning of your organs. So they need a lot of health care. So all these conditions, we have the muscular dystrophy, which is a degenerative muscular issue. And so there are these specific health conditions which are included into the Disability Act, which needs focused health interventions and which should also be looked into. But our current health programs are not really looking into these specific aspects. And what other aspects are included in the health programs? We have the control of blindness and deafness program. And while talking about control of blindness and deafness, it is again looking in at the medical model, at the from the clinical angle, and it is not looking at the social angle. It is not looking at the empowerment or socialization or the development of people with blindness and deafness, whereas it is looking at prevention and controlling blindness and deafness from a clinical approach. And we have the emergency response and COVID management and vaccination in the recent times. So this is being given a lot of emphasis, and yes, so which is very good. We are doing very well at the international level with regard to the COVID management and vaccination. And with regard to disability also, many states are providing doorstep vaccination for persons with disabilities, which is really a proactive step. Whereas when you look at the COVID care centers, the COVID care centers are not really very accessible for persons with disabilities. And also during the COVID management or the COVID pandemic time, getting our specific healthcare services from the hospitals or from the health professionals has become very difficult for persons with disabilities, which also need to be addressed. Next slide, please. So what are the issues that persons with disabilities face with regard to their healthcare system? The first thing is about the disability certificate. The disability certificate has to be issued by a medical board or the disability assessment board, which is a team of doctors from the district headquarters district hospital. Whereas because during the COVID, this has literally stopped, and so people with disabilities are not able to get their disability certificates and UDID cards. And so even whatever little benefits they were receiving, they are receiving out of the disability certificate, that is also being stopped during the COVID pandemic time. And even apart from the COVID pandemic and the certification issue, the newly added health conditions, which are the disabilities added into the Disability Act, like the multiple sclerosis, the Parkinson's, the blood disorders, they don't, they have very much difficulty in getting disability certificates from 2016 onwards, because though the act is talking about a medical board needs to issue disability certificate, the inclusion of these specialists like hematologists or neurologists are not really mentioned in the central guidelines, and so such specialists are not available in the medical board which is doing the assessment of disability, and so such persons with disabilities don't have their disability certificates as such. It's very, very few people who have received obtained disability certificate in these health conditions. And there is a lot of concerns in the inclusion of persons with disabilities in the Ayushman Bharat coverage. Like Ayushman Bharat coverage is applicable for everyone, for the general public, whereas are all hospitals covered, or are all health conditions covered? No. So whatever specific healthcare requirements are there for persons with disabilities or for all the 21 disabilities are not being covered under the Ayushman Bharat scheme. And there are these private insurance holders who discriminate persons with disabilities, who charge more premium from persons with disabilities, and certain conditions like the health disabilities they don't cover at all. So these kind of discriminatory practices are available for persons with disabilities. And inaccessible health information, like we said, the health information should be accessible, should be in a way that any person with any kind of disability should be able to understand, so that they'll be able to make use of that information. So the first step of health information being inaccessible need to be addressed. And the health helplines are not accessible for deaf people or intellectually disabled people, and so on and so forth. And rehabilitation and palliative care services at the community level are lacking. As we said, rehabilitation services are being carried out at the community only by NGOs majorly, rather than the government. And right now government is coming up with steps to cater to people at the community, and they should definitely focus on rehabilitation and palliative care for persons with disabilities, and only then people with disabilities at the community will be benefited. Otherwise they'll be left out as usual, even if the community health services are worked out by the health system, by the health departments. And health components such as nutrition is very important for persons with disabilities, and specific nutrition is required for specific health conditions, so that need to be addressed. And SRHR, sexual and reproductive health, and the mental health aspect, mental health should be promoted across the community. And WASH, that is water, sanitation and hygiene, information about water, sanitation and hygiene importance, and procedures and accessibility to for using WASH. So all these components should be covered under the health system and should focus on persons with disabilities, and it should also be made accessible for persons with disabilities. And there is a kind of non-availability of quality healthcare for persons with disabilities during the COVID pandemic, as I said earlier. So inaccessible COVID care centers and vaccination programs. So these also need to be addressed at the ground level. And we definitely need disaggregated data of persons with disabilities covered under the national health mission, covered under any national health program or any state health program. And the program need to be inclusive and have focused interventions for persons with disabilities is one thing, and having a disaggregated data for persons with disabilities under all health programs should be another thing which is essential for effective inclusion of persons with disabilities under the health system. So I have briefly covered about the health system and the issues of persons with disabilities under the health system, and also the international instruments. Happy to answer any questions if you have. Thank you very much.
May I stop sharing the screen, ma'am?
Yes.
Okay. Thank you.
Yeah. Actually, India is doing very well with regard to um, maternity, mortality rate, and to reducing maternal mortality or newborn mortality. So all these aspects, India is doing very well with regard to the other countries and at the international level. Whereas, and we are also doing well with regard to the communicable diseases. But we need to focus more on non-communicable diseases and especially disabling conditions and all the rare diseases, so that all the all the marginalized groups who are the minority groups of the community get addressed, get all these services, because every individual have the equal right to health and equal right to well-being under the Constitution of India. And so that needs to be addressed and that needs to be focused, so that a twin track approach should be carried out. When we talk about twin track approach, it is an approach by the NCPEDP. So we should be part of all the disability, not really the disability, but all the general programs. Whereas we should also have focused interventions. So specific programs and interventions for persons with disabilities, and people with disabilities should be part of the general programs and interventions also. So this is the twin track approach which needs to be followed, so that people with disabilities have their rightful health care system enabled and ensured, so that they can also lead a quality life on a equal basis with others. Anybody else has any question, any comments?
If anyone has any questions, they can share it through the chat box as well.
So if you don't have any questions, I would like to know your feedback. What is your thoughts on the reality on the health aspect of persons with disabilities in your community, in your area, and how do you think you can help persons with disabilities by creating some support systems? Ultimately, we are all social animals. Man is a social animal, and everybody use support system like
Yeah, good evening, ma'am.
Go ahead.
Yeah, may I have a question, please?
Yes.
Yeah, so ma'am, this is Dr. Pankaj over here.
Okay.
During your lecture, what I have realized that in terms of mental health, that you have given a good description, but Mental Health Care Act 2014 itself is talking about in the multiple disability, like the multiple, for example, the blind people are also having some different orientation or different mental health care. So is there any specific guideline to address the mental status of blind people?
No, actually mental health mental health is not talking about other disabilities, whereas mental health is a general component. So whatever disability a person has, the mental health aspect actually fits into. It needs to be catered to. And even if people don't have a disability, the mental health needs to be addressed. So mental health has different programs at the national and the state level and at the district level also, and at different places they have at the taluk level also, where people with disabilities and without disabilities can take the services of mental health institutes. And there are different programs for mental health as such. It is not only the treatment and the medicine or certain therapies, like now shock treatment is banned. Earlier they were giving shock treatment as well. So there are different medications and confined to a room. So these kind of things should not be done. The socialization, the socialization aspect, and to share their concerns in the community level with peers. So these kind of support systems should be enhanced, and to get them evolved by
Hello.
they feel productive of themselves. So these kind of aspects should be looked into. And we have a WHO program in Gujarat, where it looked at the multiple aspects of mental health, and it looked at vocational training, it looked at socialization, it looked at peer counseling, and it looked at being with the nature, and like the right of any person should be there for a person with mental health issue as well. So in
No,
that
ma'am. What?
aspect, it was
Why?
worked out.
Sorry, sorry. Why I raised this question? Actually, ma'am, I was a subject for the research in the AIMS New Delhi. And what they were concluding, the doctors were concluding that, the mental health in case of blind people have some different orientation. Therefore, exclusive services should be awarded for them, or, is established for them. So do you think this is a productive stand, or it is a kind of a, the discriminatory attitude that they are making because of blindness? The mental health orientation is also different. So what do you think
Actually,
about it?
if you look at, so they have studied people with visual impairment, and they have come to this conclusion, whereas it won't be so with all persons with visual impairment. So what is required is people should not be confined, or people should not be restricted, or people should not be, allowed to face barriers. So when accessibility is enhanced, when socialization is enhanced, and when their productivity and their potential is enhanced, then nobody would get into mental health issue. And generally with the other disabilities. Whereas mental health issue, mental illness is a kind of a chemical issue that happens in the brain. So for which treatment is required, and it can happen to anyone. It need not
Yes. Thank you,
happen with
ma'am.
one particular disability as such. So if they take a study on every disability or any other marginalized population, they will come with the same state, with the same conclusion only. I think so. So what is required is socialization and enhancing social participation of all persons with disabilities. And for any people, any person with a mental health issue, then specific focused interventions apart from the social participation angle, the social model approach should be catered to. So it is not confined to visual disabilities alone. If they take any other disability and they study, they will come to the same conclusion. And there are many people with disabilities without mental health issue. So we cannot actually, confine mental illness to one particular disability, or confine mental illness to people with disabilities or people with marginalized groups, something like that.
Yes, ma'am. Thank you.
And what is required, as I was saying, the support systems. So if
Right.
you look at the community, the society, there are support systems available for everyone. For example, school, education system, or the post office, police station, banks, the market, the supermarket, or the government offices. All these are support systems which we are using on a day-to-day basis. Whereas when people with disabilities also require certain support systems, it is looked at differently. It is looked at as exclusive support systems. That should
कुछ
be
इंस्पिरेशन दो हमको भी भाई जी, भाई अरस भाई कुछ इंस्पिरेशन दो यार, फुल्ली लोडेड खच रहे हो आप।
okay. So, there should be support systems in the community for everyone, for people with disabilities as well. And only when such support systems evolve, then people with disabilities can have a holistic, healthy approach, can have a holistic, healthy life in the community. And while people without disabilities are also using support systems, they should also think about coming up with or evolving support systems for their fellow persons with disabilities. Then most of the issues will be solved.
Thank you, ma'am, for your answer. I just came across a few questions in the chat box. Hema has asked that, ma'am, have you encountered any disability-specific insurance policies during your research?
Actually, myself, a person with multiple sclerosis, which is one of the 21 disabilities, and I myself have been discriminated from taking an insurance policy. I was, even the LIC itself said no to me. There is no coverage for people with multiple sclerosis. And apart from that, I have started, I worked on insurance lobby with for other persons with disabilities as well, and I found that most people with disabilities are discriminated, or either completely denied insurance, or they are charged more premium, extra premium by the private health insurance companies. So the lobby is still going on, and we are still lobbying with the IRDA and health insurance providers to first educate them and make them accept disability and provide equal health insurance service for persons with disabilities.
Yes, hello ma'am, I'm Hema. So basically I'm also someone with a rare disease. I have juvenile rheumatoid arthritis with lupus. So same thing has happened with me. Like I have tried a lot of insurance policy, but haven't got any. And since the treatment of RA and lupus is so expensive, and
Correct.
yeah, so I was actually trying to figure out what insurance policy that we could use.
So what you can do, where are you placed?
I'm placed in Rajasthan right now.
Okay, then you just go and meet your disability commissioner. Say that you have you have a rare disease, which is leading, which is actually giving you disability, because disability is nothing but it is not an impairment, or it is not just a dysfunction in the body, whereas disability's definition is to not be able to participate effectively in the society. So if it is restricting our participation, and because of lessened functioning, then it is disability. So you just go and meet the disability commissioner and say that you are facing disability because of this condition, and the insurance providers are not really taking providing you health insurance, and what is the way out. ask him to get you into the, if you have a state insurance, health insurance, then he should be able to get you into the state health insurance, and also give in writing to the the state health insurance officer that this particular condition requires medication, and if its cost is some 80,000 rupees, then to provide it in 20,000 rupees, and take the money from the the state insurance card or the Ayushman Bharat. So you can try with both these things. You approach your disability commissioner first, and also the health district health authority, or if you have the Ayushman Bharat section, you go and meet that person, and give a representation in writing, so that you can also document it, and it won't happen in one meeting. You have to follow up with the department, and we could do something about it. You also keep me in the loop. I'll
Thank you,
also
ma'am.
look into the disability commissioner's office, or whoever is the authority in Rajasthan, and we can work this out.
Thank you, ma'am. Will you please share your email in the chat box?
Yeah. I'll share my
you.
number. You can WhatsApp me.
Okay, ma'am. Okay. Thank you, ma'am. Thank you so much.
Hello, ma'am. Am I audible?
Yes.
Ma'am, thanks for your lecture. And ma'am, you talked very well about the various conventions and various services related to persons with disabilities in this health issues. But ma'am, it's now more than 4 years of this Act 2016. So what is the ground realities of these means all these conventions in India? Is there any data available that in such hospitals, in so many hospitals, sign language interpreters was appointed for the person with disability, for hearing impaired, and these all these facilities which were talked or written in these conventions. So, is there any data available to us that we can see
Yeah.
it on
So
the
that is where we are lacking, as I told you earlier. There is no data, disaggregated data with the health department, and there is also lack of disaggregated data even with the disability department, and with the other line departments. So the advocacy that we need to do, the disability sector is already lobbying for availing making the disaggregated data available at the at the public forum. So we need to come together and push this lobby. Otherwise, only when data is available, we can get the programs, and we can have the adequate budget with regard to the numbers. And the data is the source for everything. So data is very, very important and crucial. So we need to join hands together in making the government get the appropriate data. Right now, in my understanding, different states are trying to get the data of persons with disabilities at the state level, and they are trying different mechanisms. But so far they have not been very successful. But still, they could get some kind of data which is not really adequate. And so in Tamil Nadu, we are looking at some data consolidation of persons with disabilities, and we are working with different departments to collect data from different departments based on their services to persons with disabilities, and then consolidate all these data and get into a single database, and also identify persons with disabilities in the community through screening, and for which we are looking at a very easy tool like the Washington group questions, so that their persons with disabilities come out and say that they have a disability or they have an issue without any hesitation. So these kind of efforts are being taken. I'm sure it has been taken at different state level also, but yet everything is evolving, and right now we don't have the appropriate data as such, but efforts are going on at the state level, different states, to evolve data.
Thank you, ma'am.
I came across another question on the chat box, ma'am. It's from
Okay.
Soumya. She says, I believe the UDID card must also become as a centralized system for access to healthcare across the country. It is a long way, but a centralized system definitely helps. Kindly share your views on this, ma'am.
Yes, absolutely. And right now the health department is also looking at digitalizing, the digital health program, and they are also trying to have a health registry. So digital health registry is coming up, and we should be part of the digital health registry. So health registry should not leave out persons with disabilities, whereas it is looking at all people, but it should also count people with disabilities. When it comes to people with disabilities, it should not just count people with disabilities as simply people. So only when people with disabilities, disaggregated data are taken by the health department, are actually registered by the health department, then the specific health services can be provided. And yes, they should also link with the UDID. Actually, in Tamil Nadu, we are trying that as well. So hope some mechanism evolves, and some president will be set by Tamil Nadu and by any other state as well. Then other states can also follow that.
Thank you for answering, ma'am. If there are any other questions, please put them in the chat box or unmute yourselves.
Are we done? If you want to give any comments or how you can support your fellow persons with disabilities, or how you can evolve some support structures, you can also think aloud. If no comments, then we can close.
If there are any comments, any feedback, any questions, anything, people would like
Ideas.
to forward.
How we can evolve support systems for health services for persons with disabilities in the community level, which is very, very important right now. Just give your ideas. Or you can yourself evolve a support system, in your locality. Just think about it. At your college or at your community. Okay, it was nice talking to you all, and hope I could at least make some points, really reflect on health and disability, which made you think. Thank you very much for the opportunity. All the best for your course.
Thank you so much, ma'am, for being with us today. It was a very informative and insightful session. We love to have you with us. I would also like to extend a very big and huge thanks to the interpreters, Preeti ma'am and Arun sir. Thank you so much. And lastly, I would like to extend a thanks to all the participants. Thank you for being with us today. And I hope you all have an excellent course ahead. Thank you, ma'am. Thank you, interpreters, and thank you, participants. Thank you, everyone.
Thank you. Bye.
Thank you, ma'am.
Bye, ma'am.
Bye.
Bye, ma'am.
Bye-bye.